Thank you very much, Dr. Hoke, and can I just say thank you for the work that you do on behalf of so many people here in Chicago and across the state of Illinois who need the services that you're offering. It's really an honor to be here today at the Erie Family Health Center here in Westtown, and among practitioners and among community partners and among state leaders. Senator Aquino, Leader Aquino, Senator Cristina Pacione-Zayas, thank you for your leadership and your commitment to preserving reproductive rights and health care for women across our state. I also want to thank, we have members of and those who are leaders in Planned Parenthood and ICANN among the audience today, and I appreciate your advocacy as well. Patients come to Erie Westtown Health Center from all around the city because they know that they can count on culturally sensitive, respectful, and quality health care. That includes everything from contraceptives to pregnancy tests, from HIV prevention and testing to breast and cervical cancer screening and treatment, and so much more. When we talk about choice, these are the choices that we mean. Choosing whether, how, and when to be a parent requires access to family planning services, prenatal care, and other checkpoints along the way so that parent and child can both be healthy. The bombshell news out of the Supreme Court has already enabled extremist anti-choice Republicans to take their policies to a whole new level. The slippery slope that will eradicate reproductive choice has already begun. First, it's restricting abortion. Then it will control access to contraceptives. Just look at the senator from Tennessee who suggested that contraceptives should only be available to married couples. Politicians in Idaho, Texas, Louisiana, and Mississippi are floating bans on intrauterine contraceptive devices and emergency contraceptives. They want the government to control your uterus. They are attempting to shut down your family planning services. They are coming for your bodily autonomy. They want to criminalize anyone who does not adhere to their radical fundamentalist agenda. But here in Illinois, we protect your reproductive rights. We will continue to expand access to reproductive health care. We trust women in Illinois, and we will stand strong even as extremists tighten their grip, encroaching on our rights from all around us. To reproductive health care providers here at Erie and across the state, know that Illinois stands with you, not just with words, but in action. Whether it's through investment or policymaking, our family planning centers will be funded and protected. Illinois stands up against these right-wing policies because you've elected a pro-choice legislature and a pro-choice governor. And as long as we're in office, your rights will be protected. Our state's 98 family planning clinic sites fill a critical gap, serving nearly 150,000 patients in the last 2 years, almost 80% of whom fall below the federal poverty level. Pregnancy testing, basic infertility services, STD tests, cancer screenings, these sites offer the fundamentals of health care to some of our most vulnerable residents. So when President Trump, former President Trump, initiated a gag rule banning federal funding for centers like this one, who dare even mention abortion as an option for someone who never planned being pregnant, I told the federal government that in the absence of their support, the state will fund these clinics. We increased our state support for family planning centers by more than tenfold, putting personal medical decisions back in the hands of patients and their trusted doctors, where they belong. Now that the Biden administration has reversed Trump's gag rule, I'm proud to announce that we have rejoined the federal Title X program, and we're putting record funding toward our Illinois family planning program. That means 29 delegate agencies throughout the state, from the southern region to West Central to Metro East, will receive more than $11 million in state and federal funding to expand family planning services to all Illinoisans, regardless of socioeconomic status. Let this record-breaking investment remind women that the state of Illinois trusts you to make your own decisions, to choose what contraceptives are right for you, to choose whether you want to be a parent or not, and when. And we will make sure that on top of protecting your right to choose, you get the care that you deserve.